Hello, this is Dr. Gay, and this is a 72-year-old male who had a lifting injury recently. His doctor thought he had a tear of the biceps tendon and wanted to see that better, and sure enough, they are right. There's a ruptured biceps tendon, so it's kind of a quick case to look at what that looks like. And so this is a sagittal view to start with. To get some anatomy down, we have a bone down in the back. Here, this is called the ulna. Looks like a cup back here. And this round area is the humerus. So the humerus comes down from the arm, ends here, rounded, and the ulna is cupped around it. At the very back of the ulna, we have the triceps tendon coming down to attach to the olecranon process of the ulna. And in the front here, we see a muscle, the brachialis muscle, that comes down. And the black line is a central tendon attaching down here to the ulna. But now we're going to roll outwards. Now we're going to roll into the radius. So the radius is a smaller bone here in the forearm. And we can see that the radius has an articulation with the humerus as well. And kind of looks like a golf tee, the radius does. And there's a bony protuberance down right about here. This is the radial tuberosity. Down below the joint. Here's the joint. It's distal to the joint. And this is where the biceps tendon is going to attach. So we should see the biceps come all the way from up here. This is the muscle. And there's the central tendon. The muscle ends, and the biceps should come all the way down and attach over here on the radial tuberosity. But we don't see that. We see white stuff here. This is complex fluid or hemorrhage here. And this is where we should see the biceps. And instead, it's ruptured and retracted, and this space is filled with blood products or fluid. Now, if we look here, we can see that biceps tendon, central tendon here, and this is the thickened irregular biceps. And right about here, things become really abnormal. It's very thick and irregular. It looks like a paintbrush. And so this is where it is ruptured. If we roll over to this image, there's a whorled area here. This may be some of the partially torn or torn tendon fibers. They're folded upon themselves. But a completely torn biceps tendon with tendon retraction and complex fluid at the site of tear. One other thing this patient also had a finding here on the outside. This is the lateral side of the elbow. We're looking straight at it. This is the inner side or the medial side. And on this side, we see the radius. On this side, we see the ulna. And on the radial side, we notice that the dark thing over here, this is the common extensor tendon, comes off the humerus, comes down here, and it goes to the muscles on the outside here in the forearm, where there's fluid from the radiocapitellar joint, which is the radius and the capitellum, part of the humerus. This joint, fluid tracks up deep here underneath these tendon fibers. Normally the tendon will attach here in this broad footprint, but instead they're partially stripped. So there's a tear involving the deep fibers of the common extensor tendon right at this attachment. So it's not completely ruptured, but a significant tear there. And on this side, they also have a little bit of brightness at the common flexor tendon origin. So this is a little tendinopathy of the muscles. As they come up here, they form a common tendon, and right where that attaches is also injured or irritated over here on the medial side. So a partial tear involving the deep fibers of the common extensor tendon, some tendinopathy of the common flexor tendon origin, and most significantly, this ruptured biceps tendon with a mild retraction and this complex fluid at the site of tear. Thank you very much.